Hello, everyone. This is Dr. Hua Cao. Today, let's continue our Chinese medicine dermatology talk. Today's topic is eczema. Now, let's go to the slides. For eczema, before we go to the Chinese medicine section, I would like you to do self-study about Western medicine, about what is eczema, how is eczema looked like, what is the main character of eczema, what are the common types of eczema, how eczema is diagnosed, what treatment are used in Western medicine. There are so many websites you can use. Why you have to study this? It gives you a basic understanding about eczema. If patient come to you, tell you, I have eczema, and you should show your knowledge, your understanding about it. And also it's so important to understand what kind of treatment has the patient used, and skin problem development, and what can make things worse, what can make things relieved. And all of this will help you to do your own treatment. Now, let's come to the Chinese medicine. In Chinese medicine, we call eczema 湿疮, 金银疮. The main cause for eczema is considered as wind dampness and heat. Now let's come to the character of eczema. Eczema is one of the most commonly seen skin problems. As a Chinese medicine practitioner, you'll definitely see it. The skin lesion has no special shape. It appears at no special places. It's often bilateral. You see on both arms, both foot, or both side of the body. It can happen at any age, at any gender. It's recurrent. It happens at any season. At acute stage, you can see eczema all over the body. At the chronic stage, the eczema stays at fixed places. That's the character of eczema. And for the skin lesion, you can Google eczema, go to the image, you will find all kinds of skin lesion photos. It's important for you to look at it now to get a rough idea about what is eczema look like. Okay, now we go to the etiology and pathogenesis. As most of our other Chinese medicine diseases, we consider internal pathogens and external pathogens. Wind damp heat is the main cause of eczema, but they are internal pathogen, internal wind damp heat, and external wind damp heat. You have learned all of this in the Chinese medicine basic theory and the internal medicine. I won't repeat them here because normally students study dermatology after the internal medicine. You should know how is internal, external wind damp heat developed. Okay, now for eczema, it can, due to emotional disturbance, affect the liver, heart, and spleen, produce fire, heat, or blood heat, or dampness, or long time inappropriate diet affect spleen, produce dampness and or damp heat. Sometimes indeficiency and blood deficiency can generate internal wind and combine with dampness in the body, and then or combine with exterior wind. Remember, wind damp heat produce skin eczema. So there are three different kind of pathogenesis. Now let's go to the stages of eczema. We have acute stage, subacute stage, chronic stage. In the acute stage, there are different kinds of skin lesions. They can appear at the same time. It's very often only one type predominant. Maybe erythema or papular vesicule pustule erosion. And at this stage, they can also have three different patterns. Wind pattern, it has wind feature. It have rapid changes, manifests as itchiness, and it moves around. The heat pattern often appears have more erythema and the papules. The rashes are red. For the damp pattern, eczema have more vesicles and it's hard to get rid of. At the subacute stage, there's less erythema and swelling, fewer vesicles, smaller papules, and more scaling crusts, exudation, and severe itching. Some, at this stage, the skin rash, some can go to the chronic eczema stage, some can go back to the acute stage, following some external or internal stimuli. It can flare up again. The chronic stage often have blood deficiency and dryness after long-term skin diseases. Long-term eczema can damage in and blood, lead to dryness. Skin lesions appear more dry, rough, thickened, and scaling. Some places can have hyper or hypopigmentation. Itching may be moderate or intense. Repeated scratching or rubbing the skin often results in obvious lichenification. Now we go to different patterns and the treatment. There are many different kinds of patterns. I only list these 5 here. But you can read the reference book, which I listed at the end. It can tell you more patterns. The most important for us is how to identify the patterns correctly and address the treatment following your diagnosis. It's very important. Chinese medicine definitely works well for eczema. I've treated patients from 8 years old to people over 80 years old. They all achieved very good result. Okay, now the first pattern is wind damp and heat pattern. It's more in the acute stage. The skin lesion has short history, sudden onset, small papules, some with vesicles, no exudation, normally on forelimbs or trunk, very itchy. Skin lesion feels hot. The patient is restless with dry mouth, normal stool, yellow urine, red tongue, thin yellow coating, and slippery pulse. The treatment principle is dispel wind, eliminate dampness, clear heat, and cool blood. We choose 消风散 to modify. I'm sure you all have learned 消风散, and I listed ingredients here. I'm not going to read through them for the time reason. Now, modification. If rashes are manifested by red macules, papules, or micropapules due to stronger blood heat, then wind and dampness, we can choose 凉血除湿汤 to modify. 凉血除湿汤 means the decoction to cool blood, eliminate dampness. The ingredients listed here. If there are a lot of vesicles, you can increase the amount of 泽泻、苦参、滑石. If there's strong dry mouth, you can add 黄连、竹叶, also called 淡竹叶, which is the bamboo leaf. For strong itchiness, you can add more 白藓皮 and add 断龙骨. Now, next type is damp heat predominated pattern. It also commonly seen at the acute stage. A patient has acute onset, short duration, various types of lesion, erythema, papules, vesicles, erosion, and exudation all appear, maybe at the same time or at different times. Accompany strong itchiness, bitter or dry mouth, no desire for drinks, dry stool, yellow urine, red tongue with thin yellow coating, greasy at the root, slippery and rapid, or weary and slippery pulse. The treatment principle is clear heat, eliminate dampness. We choose 龙胆泻肝汤 to modify. Some student before asked me why 龙胆泻肝汤 is clean the liver heat, but here we use it for eliminate the damp heat. And remember, we modify this formula for the skin conditions. So the modifications are here. For the strong heat, we can increase 生地黄、牡丹皮. Very often Chinese medicine practitioners call them 生地丹皮. It's a simple version. With more dampness, you can increase 车前子 and 木通. For exudation and erosion, you can add 苍竹、冬瓜皮. If there's secondary infection, you can add 败酱草、紫花地丁. Normally in this situation, patients have already used antibiotics. Now, the next type is damp obstruction due to spleen deficiency. This is more commonly seen at the chronic stage. The patient has slow onset, long duration of skin lesions, light red skin lesion with a few vesicule or papulovesicular, occasionally have exudation, scaling and crusting, sallow-facial complexion, poor appetite, loose stool, pale tongue with thin white or greasy coating, slippery pulse. Our treatment principle is fortify the spleen, eliminate dampness. The formula we use 除湿胃灵汤 means 除湿 means eliminate dampness. 胃灵is is something related to the ingredients. Tang means decoction. Wei ling, wei actually means stomach. Ling means relate to fu ling in the formula. The modification here, if there's bloating, we add 大腐皮, 潮指壳. If there's poor appetite, we can add 炒麦芽佩兰. If there's strong itchiness, we can add 蛇床子, 地肤子. 蛇床子 is not allowed to be used in Australia because the pharmaceutical bureau think it is toxic. But the good thing for Chinese medicine is there are so many herbs have similar functions. You can always choose different herbs. Okay, now let's move on to the next one. Next one is in damage with accumulated dampness. This is often seen at the chronic stage as well. The skin lesion is lingering and recurrent. Lesions are located at one or a few places. The skin lesion appear dull red, little exudation, rough, lichenoid with scratching marks, crusting or scaling, accompanied by poor sleep quality, lack of energy, thirsty, red tongue with dry tongue body, no coating or patches, no coating, thin, slippery, or thready fast pulse. Our treatment will nourish blood, eliminate dampness, and elevate itching. The formula we use to modify is 滋阴除湿汤. The ingredients are here. If there's strong yin deficiency, we can add 何首乌. If the thirsty is strong, we can add 麦冬玉竹. For blood deficiency, we can change 生地黄 to 熟地黄 and add 白芍. For dampness, we normally use 茯苓折泻. We can increase it. For insomnia, we can use 酸枣仁、夜交藤、断龙骨 and 牡蛎. Now we look at next type. Is wind and dampness retention. This is also in the chronic stage. The patient has long duration of skin problems, skin condition has been up and down, skin lesion often fixed at one or a few places, skin become thicker or lichenoid, accompanied by strong itchiness. The treatment principle is dispel wind, eliminate dampness, disperse stagnation. We use 活血除湿汤. Here, if you want to, you can stop the screen and look at the ingredients, take your time. For all the treatment above, after condition has improved, you have to consider tonify spleen and the stomach. You have to tell patient, because some patient after a long time drinking this bitter decoction, they have had enough. They stop coming to see you when they have just small patches of lesion, skin lesion left. They said they can deal with it by themselves, but you have to tell them the patient need to take a slightly longer formula to consolidate the result. Educate patient to be patient. That's part of your job as well. Treating eczema can be time consuming, can take a few months. For younger people, it brings changes quicker. Okay, now let's go to the next one. External treatment. I just put a few options here. You can choose. Personally, I haven't used it for patient because it brings extra work for patient. Very often, the patient won't do it. But you maybe it's different with your patient. If for the acute stage external treatment, we have 路路通 wash and 湿疹 ointment #1. The ingredients are here. You can have a look. 马齿苋 wash is the most easily find, most easily applied for wash. And for large amount of exudation and erosion, you can use this decoction called 地鱼 wet compress. For erosion, pustules, and crusting, you can use 清代 plus vegetable oil or 四黄膏 we have mentioned before. 清代 is very dark in color. If your patient accept it, you can try. It's not difficult to mix this one. For chronic stage, mainly for dry and lichen skin, you can use these 3 ingredients, add sesame oil, but 雄黄 is forbidden in Australia again. 松香 sometimes is hard to find. So just give you as a reference. Okay, acupuncture can accompanied with Chinese herbal medicine to achieve much better result. But because treating eczema takes time, you won't achieve, very obvious result in short time. Take months, sometimes 2 months to achieve a clear or almost clear result. So add acupuncture can accelerate the treatment process timeline, but it also adds cost for patient as well. And some patients don't like needles either. So I leave the points and the stages points choices here for you to consider. And next very important thing here for eczema is lifestyle advice. It's very important. Even I didn't write anything here because we have learned in the dermatology, the general part, the general dermatology part, and the Chinese medicine basic theory part, and internal medicine part. So I won't repeat here because it can become really boring, but we need to tell patient to avoid to produce wind damp heat generating inside our body, or to avoid external wind damp heat. And also some factors like stress, anger, or seafood actually can all exacerbate the skin condition. For seafood, I have explained before, it's just found, it has been found from previous experience. it often couldn't give you a correct explanation about why seafood exacerbate all types of skin problems, but it is the fact. So try to tell your patient, stop taking seafood during the treatment time until the skin lesion is recovered, and then they can take still in a moderate amount. Okay, the reference book is here. Our eczema session is finished now. From my own clinic experience, for more than 20 years, I've seen all kinds of eczema. Chinese medicine can achieve very good treatment result. So you should be confident, and you should advise patient to be patient, take time. Another thing is I have treated someone who is 8 years old, who won't drink the decoction, and the father put all the herb granules into the capsule, and then the patient swallow all the capsules. Sometimes every time swallows 13 of them, but it achieved very good result. So you can always, modify your treatment following patient's condition. Okay, now I'll stop these sessions now. Hopefully you have learned something from my talk. The other day, I have a student came to me, asked me to help him with his eczema. And then I said, why don't you do the treatment yourself? And he said, oh yes, I did. I want to go to the Xiaofeng and then I tried, it didn't work that well. And then I try this sun and that the other sun. I say, no, that's not the way to find a treatment. You don't go to the patterns I introduced you and then go to the Xiaofeng. You need to do the diagnosis yourself. You feel the pulse, look at the tongue, and then you look at skin rashes to identify if you have strong heat, wind, or strong dampness, and then you can form your own formula according to your condition. The main thing is your problem, your health problem is addressed in your formula. Don't go to this classical formula, that classical formula. As long as you address your problems in your formula, you will achieve good results. Of course, other people give you different kind of formulas can be used as like advice, but you need to think and go through all the diagnosis methods, 4 methods plus the plus your own special condition, body constitution, and then you form your own treatment for yourself and for your patient. If you do this, you'll achieve good results. Okay, now I'll see you next time. This is Dr. Hua Cao. Thank you for watching this program. Bye.